So
goes viral, I'll regret it.
we're over here at Oak Haven Massage in San Antonio, Texas. People are taking their free trial sessions on the BEMER at the BEMER Open House. And we got Dr. Clay Suggs here. I want to say a few words, so hit it.
Okay, so I'm in practice in San Antonio. I've been in practice for 30 years, and seen a lot of things over the years. And so, as I'm a very skeptical person, as most chiropractors and doctors are anyway, because the latest greatest things usually don't live up to what they say. So, you know, you have to kind of look at things with a little bit of scrutiny there. So, after I think Monica had come into my office for about 2 months trying to get me to pursue the mat and looking at EMT, and then I finally said, okay, you can bring it in, use it on some patients, we'll see what we get. There is no sales pitch, there is no, if you want to buy one, if you want this and this, that's fine. And so she understood. I kind of had a big bar that I didn't want her to cross. And so after she would use this on a couple of patients, I started seeing some pretty good results with different variations of issues with aches and pain, issues that were inflammatory. Now, we even had one patient who went up who had a knee issue, and she'd had knee surgery shortly before, and she was hurting obviously before. She was hurting afterwards, and she got off the BEMER and said she didn't have her knee pain any longer. So that was a good thing. And then she inquired to Monica about purchasing one, and she said, oh no, this is just for show, we're not doing any of that, we're not into the sales. And she said, so I can't get one? And she pulled out her credit card, and Monica said, okay. And so,
She made her buy one.
yeah,
Made her let her buy one. Yeah.
So Monica just came to me and said, well, I had a patient who just bought one, and since you weren't already in, and sorry that I got the commission. Oh, anyway.
Not quite.
Well, that already happened. So anyway, but that's just what happens. You don't know, and then somebody else purchased one, and you go, well, wait, I'm still looking. And you go, well, when they're ready. And so, and by the way, that patient was in my office this afternoon, and she loves it. So it's been 3 weeks, and so she is like very, very happy.
Excellent.
So,
So how many cases across would you say? 1, 2, 3, 4, 5, 6, 7? How many have you seen try this and get some results that were like?
Probably seen 30, 40 cases that have seen a fairly significant positive result.
And that's like in the last 4 weeks, let's say, 5 or 6 weeks.
Yeah, 4 weeks. Yeah, I think it's just been 4 weeks. Oh, and my mother's in town, I won't tell you how old she is.
I was bent over. I was practically crawling. I was so bad because I've been doing so much the last 2 months for my brother, who has had a stroke, and I am asking her if that is a possibility that he might be helped by that. But at my knees, I have had one knee replaced, and I'm 80 years old.
Wow. Want to give her a hand right there. She looks pretty good, don't you think? Yeah.
I didn't have any help getting out of that chair.
Yeah, yeah.
I haven't had any help to get in his Jeep before. He's been
So-
having to push me.
So the BEMER basically totally re-energized you as far as range of motion,
so
movement?
Far, I've been on there about 5 times.
Just about 5 times?
Yeah, he comes and parks me in the office.
Very good. So when it works on your mom, then it's really good, right?
Yeah, if that'll work, then I'm real happy about that. But I've seen, and this is firsthand, and so I've been real happy with the results with it. And I'm going to tell a little story real quick, because I had gone to a functional medicine conference this weekend.
Yeah.
This is huge. We had doctors from all over the United States, and probably some from other countries as well. And the main doctor who speaks about this, who puts it on, it's his presentation, his deal. I had told him, I said, you need to look at EMT. And he said, oh, I have. I looked at it. And
When you say EMT?
Electromagnetic therapy.
Yeah, okay, sure.
And so I'm a little more generic on my terminology. So he said, oh yeah, I use it. I use EMT. And I said, well, I brought my mat, because I'd already talked to different doctors about it, because I told them the results I was getting, and they're telling me, well, bring it, I want to see what it is. And I'd happened to have it laying out, and I said, well, that's my mat right there. And he walked over and he said, yeah, that's the BEMER mat, that's the one I have. And I go, so you have it? He goes,
The head guy of this big conference has a BEMER?
yeah, and trust me, he can
Yeah.
afford anything.
Yeah.
This is not a, and so he said, yeah, in fact, it's in my hotel room upstairs.
What do you know? So was that a confirmation then?
So I was like, he was like, and I thought one time I'd be ahead of him, but I'm still behind him.
That's good.
So, and so in other words, he's the head guy over a bunch of functional medicine doctors.
Right.
And so if he's advocating and if he sees the validity in it, because he had back surgery, and so he said, I'm trying to prevent myself from having another back surgery. And so I was like, okay, that's good enough for me.
So
and
all-
so a lot more validity.
So all it took you to go was from skeptical to full on board is seeing it with your real patients, and then your mentor or one of your mentors finds out that he's already
definitely. He's been my mentor for 3 years now, over 3 years, and so he's my consultant.
And
so,
not to mention your mom, right? That's
and
fantastic.
my mother's in town, and so. But I will say this: it takes repetition, and if people think it's a one-time shot, in Carol's case, it was wow, but you still have to have infusion with microcirculation and things like that for the things to heal. And so I've definitely been on a very happy mode and very surprised.
And you're a patient. We have a separate video of you, but you have inflamed joints everywhere, disease that's
Everywhere. There was-
your first time results were what?
There was, even my hair hurt sometimes.
Yeah.
You know, I had such severe pain.
Right.
But it was amazing for me. After the very first treatment, I was able to run up those steps and stairs and
So one session,
Full
you're
of
able to
one
walk,
session.
walk around without stumbling around.
full
And,
of energy.
Yep.
And I used to always have my walker with me. And I haven't pulled it out of the trunk of my car since that very first session.
really?
Mhm.
So here you go,
Now,
guys.
that
a
very
mom,
first night
patient.
too. Now my husband did do the BEMER as well, so I do want to, kind of give the whole story. He is much healthier than I am, and his results on his first time were not as good as mine.
Sure.
But
Yeah, the more
but he's
chronic stuff you
healthier.
have, the more you're going to feel.
Yeah, I have
right?
everything. So
So isn't that great, guys? Give Dr. Clay a hand for doing what he's doing here.
Thank you guys.